All right, doctor. Thank you for your time today. I know it's I've been trying to talk to a neurologist for a long time. I've been around, and they're all really, really busy. So I really appreciate you taking some time. Let's just start out. What's your background, and what kind of education did you go through to get here?
I did my medicine, the undergraduate medical school in India, and then I came here, did a master's in public health, and then we have to take some licensing exams before we can go for residency and fellowships. So I did those things and then joined residency in neurology, and then I did a fellowship in critical care after neurology.
Mm-hmm.
So that's my educational background.
All right. Go through your day by day. What do you do every day? What does a neurologist do?
It depends on what kind of a subspecialty they are practicing. So every neurologist is different. So some neurologists, they specialize in headaches, some neurologists specialize in movement disorders, and some specialize in neuromuscular. So everybody's field is different, even within the neurology, because everything is kind of very subspecialized nowadays. But I do mostly hospital work, so I do see a lot of stroke patients, traumatic brain injuries, intracranial hemorrhages. So mostly it's a inpatient neurology consults I see, and then I see some patients in the outpatient clinic. So typically my day starts around 8 o'clock, and I see maybe 2 or 3 patients in the hospital before I go to the clinic. And then I see anywhere from 10 to 14 patients in the outpatient clinic. And during that outpatient clinic, I'll get maybe 3 or 4 calls from the hospital. That's a typical. And those will be for consults for stroke or emergency neurological conditions like meningitis, or it could be anything like traumatic brain injury. And I usually see those patients in the afternoon if I get some time, or I'll wait until 4 or 5 o'clock and I'll see those patients. But these are all kind of more consultative basis. They're not like a primary patients for me.
Yeah.
So there will be another doctor, like a medical doctor or somebody who will admit these patients, but I just provide consultative services.
So it's a long day then, right?
Yeah, it's a pretty long day. It starts around 8 o'clock, and by the time I reach home, it is usually 7 o'clock.
Yeah.
7:30, something like that.
Yeah. Why do people come and see a neurologist? Do you need to be referred in order to see one, or?
Yeah, usually, most of the patients are seen already by a primary doctor for headaches or for seizure or for some movement disorder like Parkinson's or something like that. And the primary physician usually work these patients and see whether they can treat first. And if they still cannot treat these patients, then they usually send these patients to neurology. And so usually most of the time, by the time the patients come here, they already have some workup done before.
So what specialty do you specialize in?
I specialize in stroke, critical care.
So that type of thing. But when you come to Carroll, you're not from Carroll, right? You're from Ames,
yes.
Correct? Why would people come and see you here in Carroll for all types
Most of the patients here, I see here, I don't go to the hospital here. So most of these patients are outpatients here. And the reason for these consults here is mostly for Parkinson's disease, seizures, dementia, headaches. So those are kind of pretty common reasons why patients come here.
What kind of procedures test type of things do neurologists use quite a bit?
We do EMGs, like electromyography. So that is kind of this machine. And so we actually check the nerves and muscles to see whether there is any nerve compressions like in the neck or in the back, and also to check for other neuromuscular conditions like myasthenia gravis, so something like that. So we do EMGs.
Is a basic...
like an outpatient procedure.
Yeah.
Inpatient, I do a different kind of a thing. I actually do central line placements and for critical care stuff. So.
Okay. What makes you different? Neurologists study brains and nerves, right? What makes you different from a psychiatrist or a psychologist?
I think... neurologists mostly concentrate on the structural aspect, Like when there is a brain lesion or something, we are mostly concerned with that. Whereas psychiatrists, they are kind of more a functional, particularly behavioral aspects of the patients. So the mood disorders, paranoid disorders, schizophrenia, that kind of stuff they see. So
How long have you been doing neurology?
I mean, I was in training for almost 10 years before coming here, and then I'm practicing here for the last 2.5 years.
All right. Have you? What changes? Has anything really changed or in the neurology world? Like, does it change quite a bit?
There's a lot of changes happening.
What kind of new discoveries has happened since your time here? I know it hasn't been very long, but
yeah, since I started practice here, there is a lot of changes too. Particularly in multiple sclerosis, there is new medications coming in. So in the past, patients has to take at least injections every week, maybe 3 times or something. But now we have pills for multiple sclerosis, and for dementias, there is new treatments coming in. And for stroke, before we used to just the window of opportunity is very less for the stroke. So only if the patient comes within the first 3 hours, we were able to treat the stroke. But now they are doing some interventional procedures to open the clot.
What about like the schooling of a neurologist? Is it more? I shouldn't say difficult than like a regular doctor, or like I know it takes a lot more schooling, correct? To go through neurology school, it's a lot more.
Right. Yeah. Compared to the primary care, like internal medicine or family practice, it definitely takes more time. For example, internal medicine residency is like 3 years. Ours is like 4 years. The residency fellowship is another 2 years or something.
Yeah.
So it takes a little bit extra time, but I mean, compared to some surgical fields like neurosurgery or something, it is less than that.
So a neurosurgeon, which you just mentioned, will you like refer them to a neurosurgeon, which is actually the surgeon that will perform?
Right. If the patient needs some surgical procedure, then we will send the patients to neurosurgery.
So when we say a brain surgeon, a neurosurgeon is literally a brain surgeon, correct?
Exactly. Yeah.
But then they also do
spine surgery, neurosurgery, so they do a lot of procedures.
So as far as like anything with the nerves or the spine, all of that stuff would be, you would treat them, or you wouldn't treat them, you'd examine them, correct? And then you'd send them to a neurosurgeon, and who would actually perform the surgery.
Exactly.
So do you and neurosurgeons, do you work a lot together? Or are you?
We have only one neurosurgeon here in Ames, and we do send patients for spine surgeries and also for nerve release or something.
So you guys, as far as the neurosurgeon goes, you guys work together quite a bit, like as. All right. Anything else you think I'm missing, like as far as anything important that your job goes as a neurologist?
I think neurology is pretty interesting field. I think new developments are coming, like new treatments are coming. So we are able to treat better these patients compared to in the past. So I think it's definitely a changing field. It's definitely worth considering for the newcomers.
Yeah. That's good. All right, well, I thank you again for your time. I know this is over your lunch break. I'd let you get back to lunch now.
Yeah.
But I really do thank you for your time today, and I'll let you get back to work.
Thanks.